歡迎大家。
Welcome to the press conference. Let me introduce the two speakers to you. We have Dr. Cheong Chuk Kwan, Head of Communicable Disease Branch of the CHP, and Dr. Vivian Zhuang, HA Chief Manager. I'll give the floor to Dr. Zhuang to give us an update of the number of cases in Hong Kong. As at noon today, we had 10 confirmed cases in Hong Kong. So far, no increase. For the 10 cases, the 9th and the 10th cases were suspected last night, and they are now confirmed. Involve 3 women and 7 male, aged between 39 and 72. There are 3 couples, rather elderly. Our Mackley Host Quarantine Center has got 41 contacts under quarantine or isolation. So that's all I have to report. Of course, we are now doing contact tracing work. Over to Dr. Vivian Zhuang. An update from the HA, please. In the past 24 hours, HA has got another 55 suspected cases reported to the CHP. There are 139 patients receiving treatment and under isolation. Among the 10 confirmed cases, well, they are all in the Communicable Disease Center in Prince Margaret Hospital. 9 of them are stable, 1 in serious condition receiving treatment in ICU, and he is on oxygen, and no intubation is required. Our medical team will provide appropriate treatment to all 10 confirmed cases. As at noon today, we've got 14 medical health care reported. Yesterday it was 12, so we have 2 more today. The 2 have been tested negative for the NCOV. They're not infected. 9 have been discharged, and 3 are still hospitalized. As for isolation ward, today and in the past 24 hours, we have added 30 new isolation beds from 663 to 697, close to 700. We have added 20 isolation wards from 353 to 373 isolation wards. As regards the occupancy rate of wards and beds, for negative pressure beds, the utilization rate is about 40% as at noon today. And for negative pressure ward, the occupancy rate is about 65%. We will monitor the situation and to see the pressure on our isolation wards. And in light of circumstances, we will start to activate a negative pressure operation of our wards where necessary. Frontline colleagues have reflected that there are visitors to hospitals. May I remind the public that we are now in an emergency response level, so no visitors are allowed in hospitals. And may I appeal to the public? Patients should wear masks when they go in and come out of hospital. They should take care of their hand hygiene and increase infection control. I believe that these measures will bring some inconvenience, but I ask for your understanding. Would like to know the mobility of people in our hospitals to contain infection. All right, we'll now open the floor to questions. Please identify yourselves and the organization you represent. The lady on the 3rd row. I'm from Cable. There is news. The 3 doctors, after coming into contact with NCOV cases, they have to be isolated. So you told us that 2 were tested negative. News has said that they were from the Prince of Wales Hospital. Can you tell us where did they come into contact with these cases? At A&E department, were they in protective gear, and which confirmed cases did they come into contact? Another case was an A&E department doctor at QMH. He came into contact with the two latest confirmed cases yesterday. It was said that he was in protective gear. He was wearing face masks. However, he has developed a fever. Does that mean that you have to step up protective gear for our medical staff? And is there anything more regarding laboratory results? And late last night, there was news that at Netherso Hospital, there were 2 patients that were tested positive and then negative, and retesting is required. I'd like to know whether results are available. And there are rumors online that although they claimed that they were not from Wuhan, in fact, they were, and they made a transit at Huizhou and arrived at Hong Kong. Can you confirm these cases? Regarding the question about medical staff, 3 medical staff, 2 of which came from PWH and 1 from QMH. As far as I know, the 3 doctors were in appropriate protective gear when they contacted the patients. Because some of our colleagues might sometimes have a fever, and to play safe, they are put in an isolation ward and for testing. For the 2 doctors in PWH, they were given the test for NCOV, and the result was negative. For the QMH colleague, he was hospitalized today. Swabs were taken today, and the results should be available tonight. The 3 doctors are in stable condition. As for the patient in Taipo Netherso Hospital, I defer to Dr. Zhong. That's why repeated testing of samples are needed, because sometimes the negative result is not very marked, and retesting is needed. For the patients you referred to, the first report was negative, but not very obvious. So another test was done, and again it was negative. This morning, to play safe, we took another swab and tested it in our laboratory. And at noon, the result was negative. Sometimes the swab taken might be taken at a very preliminary stage. So even though the result was not positive, we might be worried, and doctors would keep track of the situation and do another test, and this is not uncommon. I'm from Hong Kong 01. This morning, Mr. Chong Kin-ai said that among the 500-odd cases, some of them were non-Hong Kong residents. Can you tell us how many of them have Hong Kong ID cards? How many of them are non-Hong Kong residents? Can you give us an exact number? And the number of quarters for medical staff and the allowance. Can you tell us the actual number? I'd like to know whether some of the places have been taken up. So far, you have not provided any information. Is it because that hotels are not willing to provide temporary residence for doctors? Today, the Philippines has got the first case, who arrived at Manila on the 21st of November from Wuhan through Hong Kong. Are you aware of the flight number he was on and the number of close contacts surrounding him? How many of them were Hong Kong residents or foreign domestic helpers working in Hong Kong? And have you traced the number of contacts that have to be sent to an isolation camp?
If you're asking what are the actual figures, I don't have them at hand, because we we need to see that if they produce the Hong Kong ID card when they visit doctors. And Dr. Cho said there are 13% of suspected cases did not register with their Hong Kong ID. For the actual figures, we don't have them at the moment. And let me answer your question on the accommodation for our colleagues. For all along, you have been arranging accommodation for colleagues in need. At the hospital level, we have reserved at about 260 quarters to the staff in need. We also try to contact some hotels to see if they can provide another options for our colleagues. From what I know, the Department HA have kept liaising with various hotels. At this moment, we know aware of the urgency, thus we are providing a special accommodation allowance. So the HR department have been drafting the allowance, and it can be announced within these 2 days. On the Manila cases, I'll let the Philippine authorities follow up. We don't know which flight that person was on. How about the next reporter? The gentleman in the first row, HKEJ. I would like to follow up on the confirmed case that's one stayed at Hotel W. The hotel claimed that when the case had a reported fever, they were ready to report to the Department of Health. So why the Department of Health did not act upon until the 28th when he went to Four Seasons Hotel and sent to the hospital and confirmed. And for the interim time, what had the Department of Health done? According to CAP 599A, the Department of Health or the health officers can investigate or even arrest this suspected infectious patients. So what had the Department of Health been doing for the time? I have a question for HA. And PMH staff claimed they've been provided with outdated surgical mask. Is it true, and does it show that the HA resources are showing strain? Because you've been stressing you have a 3-month stockpile, but why are you providing expired surgical masks to the staff at Princess Margaret Hospital? On the suspected cases, they need to be examined by a doctor and to see if they fulfill the medical reporting criteria of the severe respiratory diseases, instead of just anybody accusing them of suspicious and allowed and refer us to follow up. And even for CAT 599, it also need a doctor to report a suspected case before we can invite him to see a doctor or for quarantine. Speaker, not a mic. For the Hubei patient cases entered Hong Kong, we can provide them with health suggestions if they chose to accept it voluntarily. And for the hotels, we have provided some recommendations and hope they can persuade the cases to see a doctor. However, we won't mandate anyone to see a doctor unless it has been examined by a doctor and see that it would meet the reporting criteria. Then we will ask them to see the doctor. So you will not proactively intervene? Yes. As of today, we have asked the clusters where they have received this complaint from the colleague. So far, we haven't received a formal complaint for the colleague that they've been using expired surgical masks or provided with them. Well, we are using a huge amount every day. Even inside the hospitals, the consumption and turnover is very quickly. As for the expired surgical mask, is unlikely. If it so happens, hope the colleague can tell us so that we can investigate right away. The gentleman second row, now to news. Just now, Department of Health saying it will not proactively intervene. Why? And would this led to the risk of community outbreak? Would you considering taking extraordinary measures. We know that the patients are having fever would the DH consider extraordinary measures. We know that some of the private clinics, since they have been running low on masks and not able to operate, do you have any figures on how many of the clinics or private practitioners have been in such a situation? Would you consider providing some help to them, for example, supplying them with face surgical mask? Like I said, for the suspect cases reporting, would require a doctor examination and assessment and asking the travel history, and we can't just for no reason and intercept them on the street. Even though we've heard reports from others, that is not our usual practice. As for the surgical mask, I know that the senior ranks and government is concerned about it and will explore measures to help the public. Speaking of I noticed that, but I don't have such figures at hand. Next, TVB News. Well, these few days we've heard the healthcare staff reporting sick or taking sick leave. And according to the, there are 14 reported cases on healthcare staff. And it seems to be a huge discrepancy between those that call in sick. Have you understand those staff reporting sick are indeed sick or having in self-isolation or due to other reasons? And for the expired mask, so I went to Princess Margaret Hospital. There's a photo circulating showing that the expiry date is at last August. Well, so it's been circling online. I just wonder if that's true. So let me talk about the staff reporting sick. We noticed there are more colleagues taking sick leave, and all along we had to establish mechanism on dealing on reporting sick. And the hospital level, if there are clusters of colleagues reporting sick, would that led to an abnormal cluster infection? We also have a computer system on keeping track of the staff taking sick leave in each ward, and we'd like to be followed up by the infection team in each hospital. They claim that 14 healthcare staff have been reported to the Department of Health because these colleagues have met the reporting criteria by the Department of Health. I note that a few of those had visited China and returning Hong Kong with fever. In these cases, we will isolate them. They not necessarily get treatment in the hospital. They could do it at home because they meet the reporting criteria. That's why we have isolated them for testing. And in some cases, they have get in touch with the confirmed cases, which met the reporting criteria mechanism. Thus, we must quarantine them and conduct testing. As for other colleagues, they didn't meet the reporting criteria. They could be just having a sore throat or some unwell. They can just see the private doctor and take a rest at home. As for your claims of surgical face masks that with an expiration date of last August, if our colleagues came across of expired masks, they should take it up with their superior and department chief right away. I believe that we can provide the right mask for them. Well, we noticed there are more colleagues reporting taking sick leave. Abnormal or not? Well, there are more of those. Well, this is indeed a phenomenon. I hope our colleagues, well, for those who are working, I would like to thank them. I hope the emergency and the infection control services are being affected. And currently, these two services are currently maintained and what our colleagues do at their post.
TMHK English News. First question on the fact that authorities won't particularly do anything concrete, even though they may receive some reports, not necessarily from doctors, about Hubei residents falling sick. Will this inaction over this potential risk be actually putting the public at unnecessary risk? That's my question. Second question, regarding some doctors falling ill after handling some cases. They were said to be wearing protective wear already. So, I mean, how would you respond to some of the concerns among medics or among the society that these protective gear might not be enough to protect medics who are at the front line of this battle against the virus? Third question regarding, well, because some of the medics are calling for a general strike on Monday, and if the government refuses to fully close the border between mainland and Hong Kong, and reportedly there are already over 4,000 people who have vowed that they would take part in this. So does the authority have any contingency plans in place? Are there already signs that people are taking part in such a strike? And do you have concrete figures on how many people are, well, taking leave, possibly today or over the past few days? Thank you very much.
I'll try to answer the first question first. So at present, we are receiving reports from the doctors who suspect cases of novel coronavirus infection. So we cannot force any persons in the community to see doctors or force them to go to the hospitals, because unless they have, we will persuade them to go to see the doctors and advise them to see medical attention quickly. Yeah.
My question is that putting the public at risk?
I think you have to balance whether you have to force everyone to see a doctor without knowing exact the history and the symptoms, and without seeing the doctor first, as well as whether you have to, I mean, there's a balance.
Oh. So concerning about the whether the personal protective equipment is good enough for our healthcare worker, I can say that our infection control standard is take reference from the international standards such as WHO and also CDC. So we recommend our staff to wear the N95 respirator and also after disposable gown during taking care of the suspected or confirmed novel coronavirus patient. So for those reported to have fever or have upper respiratory symptoms after taking care of the confirmed case, we just take precautionary measure to isolate and provide a test for those who being complaining with some respiratory symptoms. And luckily, all those healthcare workers are test negative for novel coronavirus. So the protective, the PPE is still good enough. And for the some of the association or staff group have some strike, and then the Human Resources Department is continue to communicate with the different staff group and also association to learn more about their views, to understand what is their concern, and I think this would put the situation in a much better position.
Next, third row in the middle.
Morning Post. So I would like to continue to follow up on the measures on following up Hong Kong is returning from the mainland. Because yesterday the Constitutional and Mainland Affairs Bureau already said that they had received 280 requests of assistance from Hong Kongers in Hubei province. So if the government have to put all these people in quarantine upon returning back to Hong Kong, so could the 3 currently designated holiday camps accommodate all these people? So if not, I mean, where could the government get enough spaces to quarantine these people? Would the government consider home quarantine or to get more holiday camps? And also regarding the 2 cases in AHNH last night, Dr. Chuan, is it possible to explain a bit more the mechanism behind why there's such a condition that the first test showed positive and then the second showed negative? Is it because the virus is so hard to be detected? And thirdly, the WHO is expected to make a decision on whether this outbreak is going to be a public health emergency of international concern. So if it is indeed the case, so what does it mean to Hong Kong, and would that make a change in the measures taken by the Hong Kong government as well? And finally, I want to ask a question for HA. So there's a rumor that in the Queen Elizabeth Hospital, the intensive care unit there are 6 nurses and 1 clerk resigned. I would like to confirm, is this true or not? Thank you.
Concerning the returnees from Wuhan, I understand the central government is discussing about this issue, and so I think they will announce when they has a solution about this, a decision about this. Concerning the the 2 cases, there's rumors about the 2 positive cases in the AAN Alice Nethersoll Hospital. Actually, we have never issued a positive result. It's just that it's not clearly negative. And then the first result was not clearly negative, and then our laboratory repeat, and then it's negative. And then as a precautionary measure, the specimens were retaken for another specimen has been taken for these 2 patients, and then it's retested today, and it's all negative. So I mentioned that we'll closely monitor the situation of these 2 patients, because just in case they are still in the early phase of the disease, it's understand that sometimes there will not be a positive result in the initial phase. So the clinicians will monitor their condition and retake other specimens if necessary. Yeah. And actually, the central government is closely monitoring the WHO advice, the latest advice, and will follow what is suggested and recommended. So we have to wait. Vaccination.
What? Sorry, can you repeat your question? I missed your question.
There was a rumor that 6 registered nurses and 1 clerk in Queen Elizabeth Hospital intensive care unit have resigned. Is it possible for you to confirm whether this case has happened? Thank you.
Yeah, we understand the staff has a stress working environment these few months, and we have set up a 24 hours hotline for them to have to show their concern and exchange the views. So I think, and we think all other healthcare workers who are working so hard in the front line to combat this crisis and also to provide emergency services.
Third row, second, in green. I'm from Ming Pao. For the couple hospitalized in QMH, it was only 4 days after they developed a fever that they were hospitalized. I'd like to ask the Department of Health, do you know where they've been to before hospitalization, the floor of Hotel W they stayed in? Was there a risk of spreading the virus in the community? After all, they had a fever. And when did you receive the report from Hotel W? And you said that a health advice would be given to the suspected cases. Did that include asking them to see a doctor? If they refuse, does that mean that under current measures, there is nothing the Department of Health can ask a sick person to see a doctor? As a result, you cannot be free of being exposed to a carrier next to you. And as for the stock of personal protective equipment for HA staff now, for full PPE and also surgical masks and also alcohol hand wash, I'd like to know the stock exactly. And it is said that more can be procured. I'd like to know when and how much. And to follow up on the situation of the 2 patients in Tai Po, for the first and second specimens, where were they taken and what tests were done? Was that the real-time PCR test? was the test for the NCOV, or what tests were involved?
其他症狀
Well, when the residents see the doctor when they feel unwell or as having a flu, when a hotel can't report to us, well, we told them that if possible, I hope they can advise the residents to see the doctor. There's a standard advisory. At that moment, it was not a suspected because you can't suspect anyone of infected unless being examined by a doctor. Then the doctor will report them as suspected cases. And for the Nethersoul Hospital cases, as far as I know, these are the respiratory tract samples, and they've been doing RT-PCR. So usually they would perform two tests two RT-PCR tests. For the first one, it wasn't a clear negative because it met some positive and negative criteria, which looks more like negative, but it wasn't clear enough. Thus, he had to redo the test, and after the second test, it still showed negative. Thus, the last night report had been negative, and since they had this ambiguous negative results, we asked the hospital to extract another specimen to redo the test. And after the test, it still showed negative. Thus, this is not considered a confirmed case. As like I said, well, due to other reasons which give rise to this testing results, sometimes the specimen extraction may not be too spot on, or maybe very minor cases would give rise to this testing result. So we're a bit concerned. So the hospital doctors will take a look. So even if they fully recover and this specimen may not producing result, or unless it deteriorates, that we need to get another specimen to see if a confirmed case. It's just a prudent approach. And for the whereabouts of the couples, and when do you get notified by Hotel W? I don't have any information of the date because we receive lots of inquiries every day. Well, I have checked with it, and they claim they have received notifications. However, I can't provide you with an exact date. So when they arrived Hong Kong in 22nd, and they stayed at Hotel W. On 28th of January, they attempt to switch to another hotel, which is the Ritz-Carlton next door, but they did not stay there. And finally, they switched to Four Seasons Hotel. They only stayed there for a few hours and finally admitted to the hospital. And for the whereabouts for the whole time, we couldn't inquire too much detail because they had not been too cooperative, but we know that they could have been to a lot of some restaurants and just done some walking about, but most of the time they're in their rooms. And some might ask, will the restaurant patrons prone being risky? Well, the close contact will usually know those cases or been with them in very close distance or having talked to them. Or for those who have met him in the restaurant, they may be worried, and maybe he can see a doctor and call our hotline, and we can see what we can do in the follow-up. Next. And for the Nethersoul false positive cases, since it's the first time we have such false positives, so how should we handle them? Are they being on the observation, or are they being discharged? And a question for HA. A question for the Queen Elizabeth ICU situation. Can you confirm how many nurses and clerks have been selected as a dirty team and resigned? And did the management try to retain them? And can you disclose the reason for the departure? Have you received the frontline feedback that while working at the hospitals, they're not able to provide adequate surgical masks and will need to obtain it from the general registry one by one. Can you provide more confidence that you have adequate supply? And hope you can respond to other reporters' question. And the full EPE and the hand sanitizers and the surgical masks, and when would the enough stock to arrive? Well, it's not a false positive, but since it's not fully sure that it was a totally negative case. Thus, we did the test. Of course, for prudence sake, we check if they have other symptoms. But so far, they are being quarantined. And on the personal protection gear, well, the hospital HA have always keeping a 3-month supply, and each day we shall monitor the consumption and also by the week. Well, there's a fluctuation and daily. Sometimes when the new stock arrive, we have a bit more. Sometimes, after Chinese New Year, under the emergency response level, since everyone to wear mask in the hospital, and also a lot of patients need to wear patients, thus the consumption is higher than usual. So that you can see that the stockpile may dip below, with a 10 to 20% variation. Well, in January, the procuring department have been start to buying more stock. They aiming for more. Hope to have a 6-month supply instead of just 3 months. I know that the stock are gradually replenished. I would like to say to our colleagues, I hope that you can please assure to take care of the patients, and we'll have an adequate PPE to staff. As for the ICU colleagues' resignation, I don't have information at hand, and we will talk to the HR to get to the bottom of it. The gentleman in the last row. Hong Kong Economic Times. As for the confirmed serious cases, what is the patient's condition? Can you tell which cases and how about his lung function and so on? And also follow up on the Wuhan couple cases. Well, the 3 hotels they had checked in, would you need to impose any isolation measures? Any staff need to be put under isolation? And for the reportable healthcare staff cases, most of them doesn't meet the criteria. If these are not pneumonia cases, so what kind of symptoms do they have? Of the 9th and 10th confirmed cases, and since they have stayed at one hotel but clearly long, and some of the staff may have what we define as close contact, or maybe like chatted to them or help them make their room. For those people, we have sent them to the isolation camp. And so did the other hotel, which as several staff also been sent to isolation camps. For the first hotel, there were 4 being sent, and the second hotel, 1. Speaker on the mic. Yes. Well, just now, our reporter asked about the serious cases at Prince Margaret. And currently at the ICU, it doesn't need intubation, however, it is on oxygen. Well, there's some consolidation in the lungs, but I will not disclose too much details. But so far, it's in a serious condition, but doesn't need intubation. I know they've been provided with medication. Our infectious control center doctors have consulted Professor Yun Kwok Yin and Professor Hui to discuss the treatment plan for this patient. Speaker not on mic. So that's the 56-year-old man. The second case. The second confirmed case. Well, if the colleague reported sick, we have a such mechanism. The department head would find out why they would want to take sick leave. We also had a mechanism in place which an infection control team will work with the department chief to see if there are any abnormal cluster outbreak. If the colleague feel very unwell, we ask them to see the doctor. If we need to be admitted to the hospital, they will visit the A&E and be admitted. But so far, these colleagues, well, trying to find out from them. And like I said, well, since for 14 reported patients seem to have some travel history or some contact, therefore we have decided to admit them.
Next, from RTHK, question for HA. Yesterday, some frontline healthcare workers said that some full set PPE and masks were locked up, given that these are important equipment. How come they're locked up? And that they have to apply for use. I'd like to know whether there is any miscommunication between the front line and the upper echelon of HA. And do you have enough supplies? And for the case involving the couple, some hotel staff are under quarantine. Are there other close contacts? And you said that it's impossible to force people in quarantine. Now, for people coming from the mainland, like apart from asking them to measure their body temperature for the first 14 days upon arrival, are there other mandatory measures available? For instance, asking them to report to a certain place for 14 days for temperature taking and asking about their condition. Is that all you can do? Now, for PPE, we have a sufficient supply of PPE in hospitals. Individual departments might have locked up such PPE according to you, but I think frontline officers should be able to access them. Is there? I have not heard of such phenomenon. I will go and find out. And as for the elderly couple, they have a family member being isolated in a hospital. There might be some others, people who drove them around. Speakers of mic. They had a car to drive them around, to have already approached the driver. No further details can be disclosed. There are 6, one in hospital, the other one under arrangement. Speakers of mic. Would we have to reconsider such a proposal? At our border checkpoints, we ask people to declare if they have been to Wuhan, and after that, medical surveillance can only be done of their own volition. They have to take the initiative to tell us that they've been to Wuhan, and then we have them registered, and they have to call us up, and then sent into hospitals if they have developed the fever. The last question, I'm from AM 730. If medical staff have contacted infected cases, would there be a compulsory quarantine of 14 days? And if they are under compulsory quarantine, will they have to have their annual leave deducted? Will they get any pay? And do you have sufficient stock of PPE and masks for healthcare workers of different physique and size? Will the size be lopsided? I'd like to know whether you can provide us with figures of staff that have called in for leave. Now, if medical worker has to be under quarantine under the advice of Department of Health, no sick leave will be deducted from them. And as for PPE, sorry, what was the question? Oh, the sizes available. Now, for our 3-month stock, yes, we have different sizes. We have a bigger stock of certain size that is more common. So far, I've not heard of complaints from staff about not receiving PPE of the right size. All right, the PCNC, thank you. Sorry, I don't have any figure regarding number of staff that have taken leave today.